My name is Katie Jens, and I am a mental health liaison at Topeka Public Schools.
Matthew Rose. I'm a lieutenant with the Topeka Police Department.
My name is Shabri Gray, and I'm an employer through the IPS program.
My name is Dr. Cindy Turk. I'm chair of the Department of Psychology at Washburn University.
So I have lots of stories I can share. It was one of my first couple years, and we had 2 kiddos that were in and out of foster care. They really struggled getting home from school, and my principal calls me after school hours, which never happens. The girls were really unsafe on the bus, and now we're in the middle of the street. Police are here. We don't know what to do. One's on top of the van, one's here. I was able to call Astra, the crisis line, and Crisis actually met me in the community, and they helped them safely get into the kinship placeman's car, followed him to Crisis, gave him a safe space. It was a really good way of Astra community school all in one, like encompassed. And it was because of Astra's relationship with the school specifically. They knew the girls, they knew me, I knew the clinician, so it was able to be handled and made sure the kids were safe pretty quickly. And I was very appreciative that Astra was able to meet me in the community and do that for our kids.
It was first brought to my attention. I didn't really know much about the program. I, at the time, was just an assistant manager, and my store manager at the time brought it to my attention that we'll be working with individuals in the IPS program, and that there might be some things that we can do to assist them to overcome those challenges they have in the workplace. And I didn't understand that it would make such a big impact. To this day now, I still have the same employee who was the first one there, part of the program. This individual has really shown me that anything's possible for anybody, and so now she has friends not only at work but outside of work. She went from being entry level and scared to do the littlest things to now being in management and now teaching employees coming in the skills that she was so scared to learn. And it's hard to explain because it's just like also unbelievable that somebody can have so much pride in their work by just being who they are, and you see so much progress and growth there for them.
Behavioral health unit was stood up at the department around 2013. In 2020, there was an opening as a sergeant in that position. I had previous struggles with mental health myself, so when the opportunity came up to be the supervisor of the unit, wanted to use my personal experiences to help shape that unit into what it is today. The main purpose of the behavioral health unit is to reduce stigma and to help guide people going through a crisis into the correct places. So I think we can all appreciate that jail isn't necessarily the best place to receive mental health treatment. And if we can take our time, try to build a relationship with that person and get them into mental health treatment, ultimately they'll be better off, and we should have less interactions with them in the future while they're leading a more productive life. You wouldn't immediately think that police officers and social workers can get along on a fundamental level, but whenever you're responding to a call, having both levels of expertise is invaluable. We really couldn't operate nearly as well if it was just an officer or just a social worker. A lot of the people that we come into contact with that are in crisis believe that they're the victim of a crime, that they had seen somebody break into their house and shrunk themselves and now they're living in the ceiling fan. She doesn't feel like she needs mental health treatment. She feels like she needs to file a police report. And so having those two together all the time, she doesn't want to talk to the social worker, she wants to talk to the police officer to file a report, and vice versa. A lot of people don't want to speak to the police officers, they'd rather speak to the civilian, whereas they can work directly with the social worker in a very ambiguous environment. The officer could just kind of hang back as security while the social worker does what they need.
There is a big demand for more therapists. I think that that's an important part of Washburn's mission, is training master's level therapists who can help with that mental health shortage. And of course, Astra helps us in that mission by providing internship opportunities for our students. Astra is an ideal place to place interns because it's very training centered. Not all places are very student focused and training centered, and Astra is. The other thing that's very helpful about Astra is that it's very client-centered. And that's, of course, the kind of environment that we want people to be in, an environment that's very client-centered and very student-centered. You know, our students uniformly have a very positive experience here. And It always is neat to see what they go on to do. We have a master's level advisory board, and most recently the person on the advisory board was a graduate of our program. She's now the person who clinically supervises the master's students that we send for training to Astra. And so it's just neat to watch a student like that, who I remember her back, just having her in class before she'd ever seen a client, to now advancing to where she is. I mean, that's one of the things that's just very meaningful about my job. The benefit of keeping local and passionate talent in our community is to best serve the clients in our community so that they can reach their potential and live their best lives. So our understanding of mental health, one of the ways it's changed, I think, the most is that I think people are becoming much more open to talking about mental health and seeking help, just being more open about it. I mean, I think that that's one of the things that's changed the most that I've seen from when I first started.
A better understanding of mental health, it can strengthen our community. Like I said, I've already seen teachers asking questions. I see parents getting more involved, bringing it to the school, It can just open up so many avenues to better educate the whole family, which can then educate your neighbor, then your cousin, and it can just bring awareness to help get more kids the support every day.
Whether you're a teacher, whether you're a police officer, whether you're an employer, I think it's important to be able to recognize when someone's struggling with mental health problems. It's also usually because of a difficult environment that they're living in. And teachers can do things to make that environment better. Employers can do things to make the environment better. Police officers can do things to make the environment better. So improving the system is going to improve the life of the person who's struggling.
We wouldn't be successful without Astra. No one, including a master's level social worker that we have in the car, is going to be an expert at everything we're dealing with. And so when you're able to access Astra as an entire organization, whether it be for an adult, for a child, for suicidal ideations, being able to engage with other personnel from Astra, and just tapping into their expertise and how to deal with the varying issues that we run into, the different levels in the facility that they have, the different levels of expertise from every varying department of Astra are available to us, including even just the system to where the social worker is able to share with us pertinent information about that client. And the more information we have going in to talk to someone, the more successful that we're going to be.